I can introduce you, unless you want to do yourself. Do you want to do yourself?
I'll let you do it. Or I'll do it.
I'll do it. Okay, you do it. You do it. I'll tee it up.
Hi, everybody. Welcome to the Dutch Live Vet Stream. My name is Joe Spector. I'm the founder of Dutch. We're an online veterinary service. We provide advice. We provide telemedicine for folks all across the United States. And I have the wonderful Dr. Kate Eldon with me. She's our Chief Medical Officer. And then we have a special guest today, Dr. Anthony Carr. Dr. Kate, do you want to set this up?
Perfect. Yes, I'm Dr. Kate Eldon, licensed veterinarian and Chief Medical Officer at Dutch. And we are excited for today's live stream. We're going to be covering two topics. We're going to be talking about tummy troubles, GI issues in dogs, and urinary issues in cats. And I'm so excited to introduce our guest today, Dr. Anthony Carr. He's a board-certified internal medicine specialist, and he's coming to us live from Saskatoon. So, Dr. Carr, I'll let you introduce yourself a little bit more than that. I can brag on you, but I'll let you do that first.
Yeah, I'm a board-certified specialist in internal medicine. So it means that after I got done with my vet school, I did another year of an internship, and then I did my residency, which was another 2 years in Wisconsin. So now I focus mainly on internal medicine issues. Don't do any surgery anymore. Don't miss it. So all that's kind of nice. I actually went to vet school in Germany, in Munich, and then came back and did my internship in Missouri and residency in Wisconsin. Now I'm up in Saskatoon. I've been here for 26 years as a professor in the Department of Small Animal Clinical Sciences. I enjoy what I do. I like what I do. And the good news is that we still don't know everything, but we try to get better at it every day.
I love that. I love hearing that you trained in Munich, but you also worked here in the States at Wisconsin. And one thing that you left out that I couldn't help but notice was, so you spent your career teaching vets and publishing research, and you've published around 90 papers. That's a lot. Pretty impressive.
Yeah, it's a fair amount. Yeah, and the thing is that what I like about my job here is that the stuff I published, I actually enjoy publishing. Like and my main interest is clinical medicine. Like not so much super science, but I just like to really try to solve the clinical issues that we still all have as veterinarians. I also wrote a lot of papers for vets just to try to keep them updated as to what's going on.
One of the, so Dutch, we started working with you as an advisor based on your specialty, and there's lots of folks, both customers, clients, as well as veterinarians, who are very curious frankly, how do you do telemedicine for anything? How do you do telemedicine when your pet can't talk? And often there's a difficult choice between folks, especially those who live in rural areas, of deciding, do I do anything? Do I use ChatGPT or Dr. Google, and how safe is online vet? Can you even do anything without, doing a full physical exam on a pet? And, we could certainly throw you some cases today that we see of questions people have. In fact, maybe we can start that way, by actual examples. But I think, like I said, this is such a new arena, and there are so many people, what we see is that almost half of our clients report that they basically just don't go to the vet at all. And so it's not a choice of, is it better to go see in person? It's a choice of doing nothing. And especially, so when it comes to UTIs, I think I'd love to maybe just overall get your take on how and whether telemedicine, what kind of a role does it play when it comes to those issues?
So it depends, and specifically with Dutch, you have two species. You've got cats and dogs, and they're kind of, especially with UTIs, are kind of diametrically opposed. Like there's in a dog with a UTI, especially a younger dog, let's say under 7, 8 years, so if they're showing signs, they have to urinate more often. It seems painful to them. You may see blood, things like that. Then most likely it's going to be a bacterial infection, and those can be treated fairly simply. And the other option would be that it might be stones, which again, those might take more effort to fix. But again, that's going to be the most common causes in a dog. Whereas in a cat, it's probably going to wind up being what we call feline idiopathic cystitis, or in other words, a bladder infection that we don't know what causes it. It's not quite true. We sort of have an idea what causes it, but it's not caused by stones. It's not caused by bacteria. It's caused by cat's response to stress. So it is a situation where their lifestyle isn't quite what it should be. Because cats would probably love to be outside and run around and chase things, but that's just not what's going to happen in most places. And so, as a result of that, it's kind of discombobulated them hormonally and just in response to stress. So as far as telemedicine goes, I mean, to be honest, in most of if it's a young animal, and goes back, I was in general practice for about 3 years before I went back and did my internship and my specialty training. To be honest, in most cases, if it's a young dog, we're going to do a physical examination. We're going to find if they come to me, when they used to come to me as a generalist, come in, do a physical examination, not going to find much. And then the choice is, well, do we do a urine sample or not? And if you play the odds, I said in the younger dog, that's the only signs they have. They're otherwise perfectly fine. They're eating, drinking. Antibiotics are not a bad choice. It's really what happens when that doesn't work, or it works for a while and doesn't work. Then it becomes a little bit more complicated. But the majority of cases we see are simple and really can have a simple approach. And is it wrong to do urinalysis? No, but again, in some cases, the cost is prohibitive in some cases for some people, and it's worthwhile just trying a first course of antibiotics and seeing if that clears it up. Maybe together with a little bit of a non-steroidal, just to help with the signs. Now, whereas in a cat, antibiotics the first time around, probably not appropriate, because the chances that it's going to be a bacterial infection are about 3%, something like that. So in that case, not worth it. And then again, it really just depends. As a start off, I think that's great. And so, Dutch with telemedicine offers the owners in a dog a very viable option to get the ball rolling. That doesn't mean we're going to be able to do everything for them, because they may need further workup, but at least for most cases, we can take care of it.
Awesome. One of our first questions from Joy Heather, she says, I think my cat has a UTI. Am I able to get antibiotics for something like that with this service? You sort of answered that right now.
Yeah, and again, it depends on the age of the patient, right? It depends on female, male. If it's a male, the chances are much less likely it's going to be an bacterial infection. If it's a younger animal, which in most of these typical cat UTIs, the FIC, they're going to be young animals. Antibiotics, you could get them, but they're not likely to work. But what you can get from us is realistic information as to what you can do for your cat and what you have to watch for, because it may be, especially in a male cat, it's possible that they'll get blocked. And if they get blocked, that's an absolute emergency. I mean, it's an absolute life-threatening emergency. It takes about, they can't urinate anymore, and in about 2-3 days, that's the end of the cat. So we can give you information about that. And again, we can also give you information about things you can try to do. And just be aware of the fact this isn't a bladder issue. That's what there was one of the people calls it Pandora syndrome. So although the bladder is the manifestation, actually turns out these cats also are more likely to cough for whatever reason. And he had a colony of cats that when the technician that always fed the cats went on vacation, some of them would start showing signs. And the signs were wanting to urinate more often, urinating outside the box, defecating outside the box. And so just stress cause it. And then we can give the recommendations for how can you reduce stress, classically, if you have more than one cat, that's kind of stressful. If you have more than one cat and only one litter box, that's going to be really stressful. So different litter boxes, different substrates, so clay, paper, whatever, preferably not next to the furnace where it's noisy and scary. Some like them covered, some don't. And then hydration. That's a really important thing that cats don't drink enough. Um, Again, you may have to adjust your life to make your cat happy, but that may very well fix the problems with the urinary tract in cats.
I had a case just yesterday on our platform. This really sweet owner, and he had the most beautiful cat. And the cat was sitting there relaxed on the couch, just purring in the sunshine for the appointment. He's explaining what he booked the appointment for a UTI in his cat, just like how, it was almost exactly like this presentation. And something gets forgotten like a lot. We want to be able to fix, like, veterinarians and pet parents alike, we want to be able to fix things. We want to be able to fix them quickly, and it's always this, like, sometimes you have to brace yourself in that moment when you have that conversation, because you're never sure how it's going to be received, that, like, hey, this isn't going to be a quick fix with an antibiotic. But I explained, this pet parent was a nurse, and I explained to him that, hey, tell me a little bit more about, has this happened before? And I could see the wheels were turning. He's like, yes, this has happened before. And you know what? I've got 4 male roommates, and they're moving all over the house. And sometimes I go out of town, and we're like, aha, so we talked about lifestyle changes. And like you said, the 2 litter boxes, putting the litter boxes in a specific part of the house where, the cat didn't have to go out into the living room, or didn't actually have to leave that pet parent's room to use its resources like food, water, and litter box. So actually, like, the most valuable thing that happened in that appointment was really that conversation around, how do we manage the things in the home? How do we, like, and we can actually do a tour of the house and figure out where things are, talk about the litter box. Like you said, some like them covered, some don't. There's no rhyme or reason. We're all different individuals, same as the cat.
One thing you mentioned, Dr. Carr, that I don't, tell me this if I heard this correctly, having 2 cats, having multiple cats is stressful, adds to stress.
It certainly can. I mean, again, it depends on the personality of cats, and you would figure that having company would be great, but not all
Yeah.
cats enjoy that. And it doesn't even have to be that you necessarily have 2 cats in your household. We've seen some where there's just a cat in the neighborhood that keeps walking past the window, and that gets them upset. And so
Yeah.
again, in cats, again, it's really hard to say. Sometimes maybe the cat would want you to move out because you're stressing them out. But again, they call it, the term for it is memo. So multimodal environmental modification is kind of where they're at. And again, there's a lot of tips you can give. Not all of them are feasible in every environment. You just can't do everything. But if you can try to do as many of those things as possible. The problem is that, the traditional route with medications, they're hit and miss. And unfortunately, there is a similar disease in humans called interstitial cystitis. And there are other, and now it's not called that anymore. It's called actually bladder pain syndrome. And those 2 are incredibly difficult to address in humans. Like the medications, there are some that work a little bit, but they're not terribly effective. And it's kind of the same thing. Where actually, mindfulness and all, I don't know how you make a cat mindful, but again, in people, those kinds of treatments actually are as effective as medications. So it is important to, and I think that's one of the advantages of having a veterinarian actually give you the advice. That's better than Dr. Google, because you'll get some wacko stuff out there that won't necessarily work.
Mhm.
And so at least to get, started, it may just be the start down the road. You may have to, use the internet for further resources to ongoing, but I think it is important to get kind of that information from somebody who has experience with it and knows kind of what's realistic and what isn't.
Yep. So for those joining the stream right now, we're talking to Dr. Anthony Carr and Dr. Kate Eldon about online vet, and especially how it can help with UTIs. But again, this has been fascinating because on the Dutch platform, we each membership people can have up to 5 pets. And so it's quite common for us to see multiple pets on the platform. And it's fascinating to hear. I think it goes against what we think of as humans, who are creatures of being around others, that with cats, that having multiple cats stresses them out. And and like you said, maybe their owner stresses them out. And I'm guessing it doesn't really, it's the same thing if it's like, because the other thing I think we see quite common is cat and dog. It doesn't matter to them who the other creature is. Is that correct?
Yeah. And it doesn't matter what kind of changes in the environment we see it. Cats that where somebody has to move, and again, it's really hard to know exactly, but certainly with cats, there are certain things that are going to, if they have multiple cats, there's going to be certain areas where they don't get along. And one of them is, if there's only one litter box, then competition for the litter box, competition for food. Those things are known to cause problems. And dogs, same thing. I mean, again, it depends. Just like in people, there are going to be some animals that are going to be resilient and aren't really going to care. And there are other ones, for whatever reason, that just can't handle it. And it has an impact. If you look at these cats and you look at their hormones and you look at their neurologic system, they're abnormal. And then so the question is, do they react this way because those things are abnormal, or does the constant stress make those things abnormal? And they don't have the answer in people either. I think most likely it is just kind of chronic stress. And again, there's a lot of things that stress some people out and not others. That's in some cats that just makes them show signs. And again, in cats, it tends to be a lot with regards to urinary tract signs, or sometimes defecation outside the litter box, things like that.
And so you're saying the same thing could happen to dogs. Is that correct or no? Like do dogs appreciate companionship, or does that stress them out?
Yeah, I think dogs, I don't know if they appreciate it, but they don't manifest their signs that way. I think they have other ways of showing that they're stressed, although usually that's aggression or hiding and things. It's more behavioral than anything else.
Right.
We don't really identify kind of that same syndrome in dogs. But again, I think in dogs, mainly with competition and things like that, I think you wind up seeing behavioral issues for the most part.
I was going to say, I think about it like, humans, we tend to be like, we're tribal people, and dogs tend to be pack animals, but cats naturally are more solitary animals. And that doesn't mean that some of them don't actually like enjoy being with groups. And it's like, you never know which cat is going to be one that gets along well and, with a big family, but just some of them manifest that anxiety differently. Because people ask me, why, doc? Why? Because I've had so many cats, and why is this one peeing outside of the litter box? And I hear them, I just feel it because it's a problem for them and their family, and dogs manifest their anxiety and stress differently. Yeah.
Mm-hmm. One thing I've seen,
uncommon. Go ahead.
We're starting to see a lot more senior pets as well. And something I've seen on Dutch is one animal passed away and the other animal is manifesting sadness, I guess. Is that a correct way to describe it? Is that part of like just a change that happens that could add to stress?
Yeah, I think in cats, well, again, maybe the cat is happy that the other one is no longer there, but I think in general, it depends on, again, it's like with everything, right? If the relationship between the two cats was great and they were friends, then of course it's going to cause a gap for them. I think they're I have more experience with dogs. That's more my thing. And I know for sure that, they for sure feel those kinds of things, that they miss their companion. Again, depends how good their bond was in the first place, but they do grieve. And I think that certainly in a cat it's impossible to interpret how a cat's going to interpret its environment. But it certainly could be an issue. Then again, if you think, well, they're going to be sad, so I need to get another cat, that may be not necessarily the right choice either. So you just never know. You just got to try to do the best you can.
We were talking earlier about I think this issue, and a customer asks Levita, can you treat recurring UTIs? And I think we see this often. Someone comes in, it's addressed. And the other, we should point out, we do send out test kits so that you can do a urine analysis, send it back, so we are knowing what's going on. But there's just folks who have recurring UTIs. And I think you were talking about also, okay, so there's one question around, can you treat it and what should you do in that case? But on the other hand, maybe thinking about what's causing the underlying issue that's creating the recurring UTIs as well. So I kind of almost see it as like, what do you do when this is happening? But then what are the things you should think about to address the underlying issue?
And I do.
And again, if it's
it's just so you know too, Dr. Carr, because I don't know for how long we've had urine test kits, but for as long as I've been at Dutch, we've had the ability as vets to send the urine test kits, and we send a good amount of them. We can do test kits for dogs and for cats. For the cats, they come with a non-absorbable litter, and we can do a culture on those if we want to. Yeah, so that was one thing that I wanted to point out, thinking about that.
Yeah, and again, it depends on the species, right? So if it's a dog or a cat, I still don't think I would have a problem with just first time in a young dog that's having clinical signs to just give it a 3 or 4 day course of antibiotics. I don't have a problem with that because I think in most cases that's going to be the answer, and you're not is and there's always, what's the risks for it? Well, again, not every animal's going to tolerate antibiotics, but in general, there's not a big risk from that. I think the problem we run into is if we have dogs and we just continuously treat them with antibiotics without actually looking to see what the underlying cause is or figuring out what kind of bacteria is involved, then that's not good, because if we continuously treat with antibiotics, we are going to get extremely resistant bacteria that can be hard to clear up, or we may be missing the whole picture because there are other reasons to have those clinical signs besides a bacterial infection. It could be stones. And again, those aren't going to necessarily get better with antibiotics, or even in some sad cases, it could be tumor or something like that, a cancer. So when you have, again, the first time around, treating it with just antibiotics, I personally don't have a problem with that. I don't think that's bad medicine. The second time around, I really think a dog, you should have a urinalysis done. And if it turns out to be bacteria, they should be cultured to see what the most effective drug is. If they recur, then again, that we do see those cases where they just have bacterial infection after bacterial infection after bacterial infection. And that may require a little bit more workup. Like we may have to, like they may require to actually go into a vet to have imaging and to look at things that might be predisposing them. And the other good thing about urinalysis, it will tell you a little bit, how concentrated the urine is. In cats, again, if it's a recurrent episode, it's definitely worthwhile seeing what it could be. And again, I don't know that in general, in a younger animal, the chances are just so low that it's a bacterial, that it's much more likely to be the idiopathic cystitis. And then working that up more might be, an idea, or maybe trying some of the medications, even though they're not always effective, they do work in some cases. So again, recurrent UTIs can be treated, but it depends on the species. There are approaches, and many of them can be done without necessarily advanced imaging and diagnostics, but at some point they may require them.
And one thing we do for our vets is if your pet is seen on the Dutch platform for any condition, and definitely including UTIs, if they're coming in twice or more in the same year for a condition, the veterinarian gets a little note that's in red that says, "Hey, flagging this as chronic and recurrent," so that we know to say, "Hey, we know to pause and have that kind of conversation, so that we're not, so we're not missing that, hey, that this has come back and we want to talk about the underlying cause a little bit more." Because I'm with you on, if this is a young pet, a young dog, and they haven't had a UTI before or haven't had one in a long time, treating empirically, with antibiotics makes sense. And the course, like when I first started, we used to treat with a week or two of antibiotics, and now the recent research that we follow is 3 to 5 days for normal uncomplicated UTI should be enough for them to improve, which is really great. It's great for everybody. It's great for the pets, great for the pet parents. Nobody likes struggling with their pet giving them medication. So yeah.
And on
I mean,
that,
the thing is,
oh, go ahead.
these are common problems. Sorry, these are common problems. And I mean, there's data I kind of have access to that shows in cats, urinary tract problems are the second most common problem they have. GI is the first most common, and urinary tract is the next most common, and it's by a lot in comparison to everything else. So it is one of the most common issues that cats have, and we know that, right? If you've been in practice, and it's not so much. It's the fact that they decide to urinate outside the litter box that's a major issue, and that's how we know it, that it's there.
I think a lot of times when customers are coming to Dutch, they're concerned, how do I get them? And we have 2 questions on that from Cherry Morrow. How long does it take for a prescription for a UTI to arrive? Isn't time of the essence? Do you want to answer that, Dr. Kate?
Yeah, so it's a great question. I mean, of course, and this depends. Like, so if we've got a dog that's a first time UTI and we're suspecting it's uncomplicated, absolutely, yeah, we want to start antibiotics quickly. If it's a cat, then the plan might not be to actually start antibiotics, but to do another treatment plan. But for shipping time at Dutch, we have 24-hour shipping, so we can get medications next day, and we can also do transfers. We can do quick transfers. A lot of what we transfer medications to local pharmacies as soon as they come in, so it's pretty quick on our end. But what can happen is the pharmacy themselves have to process the prescription, and that can take time because they're working with their own pharmacy staff and their own lines and things like that. So we move quickly on our end when it comes to prescriptions. Yeah.
Yeah, we see that a lot. People with a UTI, everyone wants speed today, but this one, I think people want the most speed, and we work with local pharmacies to transfer often same day because we understand that people want to get it take care of their pet immediately.
And like that pet parent I spoke with yesterday, like some people aren't able to get an appointment same day without going to emergency or critical care. And then they're like, I have to work tomorrow. So realistically for them, in order to get a prescription of antibiotics, they're looking at a day or two as well. And so I don't think that, you have to make a decision about how you're gonna go about it. It's not always perfect, and we want to get things done as fast as we can, for sure.
How urgent are UTIs? So again, when we're talking in this matter of hours, days, etc., because I think people want to take care of it immediately, but I'm curious, based on your experience, Dr. Carr, how often is it before the pet parent notices it? I mean, do you see that people notice it pretty quickly? And then the other question is, how quickly, again, first of all, like you said, it depends, because in some cases for a cat, it could be, like you said, you mentioned 2 to 3 days. It's a matter of life and death. So maybe segregated cat versus dog in your answer. But yeah, I'm curious, like for a dog UTI, how urgent is that versus for a cat UTI?
So again, it depends. So in dogs, it depends a little bit upon male or female. In a female, the urgency is obviously built by, well, there's 2 things. One is, first, if they're urinating in your house, which is not fun. And so that is one of the ways you find out that your cat or dog has a problem, is because they're urinating when they're not supposed to. And the other is just especially if you're walking your dog and doing things like that, you'll see that the dog is just uncomfortable and is trying to urinate and trying to urinate. So in a female, generally, although it is from a clinical signs urgent in that the cat and your pet's uncomfortable and you want to fix it, it's generally not life-threatening if it's a little bit delayed. Now, in a male, the main thing is in males, because of the urethra being much more narrow, both in cats and dogs, they're the ones that can obstruct. Now, in cats, obstruction is much more common. In dogs, it's much less common. And in those cases, it's almost always a stone. So as long as the animal's still urinating, even if it's small drops and stuff like that, it's probably not a big issue. And so although it's distressing for the patient and it's distressing for the owners, in most cases, it's not a life-threatening thing. And again, the main thing is as long as they're urinating, you're okay. Like that's not going to become a major threat. There's always the potential for ascending urinary tract infections and stuff like that they could go up into the kidney, but that's incredibly rare.
I think that's also, I explain that to owners. I think it's also, there's like a discordance between, if they're urinating, we're like, good. But for the pet parents, if they're urinating, they're not, they're not okay with that. And so, yeah, that's, I just wanted to call that out. And then I think as a woman, I can relate to urinary tract infections are uncomfortable. And I've seen, pet parents empathize with their pets about that. And they're like, well, I know what this feels like and I want to take care of it quickly. And so I think that's also, while it might not be life threatening, it's just, it hits that.
We talked about the underlying issue, and there's a question from Paula Atkinson. Can you prescribe urinary prescription cat food? And I'm guessing it's not just about can we prescribe it, but it's more about I'd love to get your take, Dr. Carr, on the notion of food as a preventative for UTIs, and potentially other dietary changes when it comes to preventing UTIs. What's your take on that?
So again, UTI, theoretically, that's a urinary tract infection. So the diets aren't really going to have an impact on that. Where in dogs specifically, where the diets are most appropriate is to reduce the chances of bladder stones. And sometimes those bladder stones are also more likely to occur when they do have a urinary tract infection. So that's really what the diets are for, is kind of to prevent stones. In cats, stones are incredibly rare in cats. So that's probably not going to be of huge benefit. Again, they shouldn't be on a horrible diet. They should be on a decent diet. So one of the gurus of this whole area, he says food makes absolutely no difference. It's really because it's all stress. So changing a diet may stress the cat out, but having a poor diet may stress the cat out. So again, having a decent diet has the benefit of that it's probably better for the cat. There's really only one diet that's been shown to have an impact on these episodes. So the clinical signs that cats have. All the other ones, again, not really been clearly shown. And those diets are meant to not address stones. They're meant to address stress. So they have compounds in them that are meant to reduce stress. Kind of like turkey, like basically
Tryptophan.
The post-Thanksgiving lullness, tiredness, that kind of thing, happiness.
And we do ship therapeutic diets, prescription diets through Dutch. And I do, when you were talking about this, Dr. Carr, I was like, I think of food as medicine. And I think about diets there are prescription diets for cats that are focused on reducing stress and urine dilution. And yet for dogs, stone dissolution. One thing that crossed my mind, though, is if we're talking about urinary issues, is making sure we're understanding the underlying cause, because diet is the cornerstone of therapy for kidney disease. And so If that is part of the underlying cause of the cat and their issue, then diet's definitely an important part of that.
Yeah, that's where you're gonna see a lot. Like I said, the first time around, again, and it's a different population, but if you start getting an older cat, more senior cat, then you do worry about the fact that maybe the underlying cause for the UTI is that they have a urinary a kidney issue. Because when one of the things that prevents an infection is just this very, very concentrated urine that cats have. I mean, it's not pretty, and nothing wants to live in there. And so when they, however, get more dilute urine, which is a consequence of having kidney disease, then you do start seeing more common UTIs. And of course, with in a cat, if you get a random urine sample, so if people send in the urine sample and it's dilute, there probably is an issue there. Because cats,
Mhm,
there's a lot of stuff they do when they're not feeling good, and a lot of crazy they do, but drinking too much isn't one of them.
mhm,
Whereas in dogs, that's one of their signs of stress, or just being, not being exercised enough or anything like that. They'll just drink water, water, water. But in a cat, a dilute urine is a possible sign of real issues.
mhm. I think that's one of the most valuable things that we get from our urine analysis test kits is the urine concentration and that protein creatinine ratio. Um, yeah,
Last question so far from Joshua Crystal. He says, my dog was recently diagnosed with pancreatitis. He takes meds and eats a prescription diet food. Can you help with that? I'm not sure what that means. Can you help with a prescription diet?
that we can definitely do,
Yeah.
and that's usually a low fat diet. I think uh, when I hear that pancreatitis, I want to always distinguish between like an acute pancreatitis or kind of a smoldering or a chronic pancreatitis. And for chronic pancreatitis, is the low fat diet is a really important part of their treatment plan. Kind of going forward for life, they're usually going to be on a low fat diet. So we can definitely help with that. But if the signs are more severe, um, like if the dog's looking sick from pancreatitis, then that warrants an in-person visit because those dogs can get sick really fast. I don't know. What are your thoughts, Dr. Carr?
Well, again, it's the thing. Diagnosing pancreatitis isn't the easiest thing in the world to do. There are blood tests, but the blood tests aren't super reliable all the time. They have false positives, false negatives. Imaging, so ultrasound can help us. So again, the diagnosis is difficult because what we see, the clinical signs are generally maybe abdominal discomfort, maybe vomiting, maybe weight loss, those kinds of things. But that can very easily be something else. So that very easily can be inflammatory bowel disease. So it can be a problem of the bowels, could be a problem of the liver. So again, I mean, in general, certainly pancreatitis or a GI problem are very one of the ways to address them is with a diet. So I think that having an appropriate diet, either low fat's always ideal, and possibly less allergenic, so a little bit of a hyperallergenic diet at the same time, that's really a good approach to most of the things that are going to look like pancreatitis. Medication is always a little bit of an issue. There are some things you can give, mainly to decrease discomfort and possibly pain, but there aren't a lot of things that are super effective with pancreatitis as far as medications go. But definitely, diet is a very, very important approach to those kind of clinical signs.
We have a question from Julia Lamora de Bella. Do you help manage diabetic cats?
It's a great question. We do. We can. There is a lot that we can do for um, cats that are diabetic through telemedicine, especially if they have a Freestyle Libre. If they've been diagnosed with diabetes and they're started on an insulin, and we're talking about making sure that they're giving the right dose, um, and kind of managing them after they've been diagnosed. We can see from a remote monitoring tool that checks the insulin from a cat called a Freestyle Libre. We can see what their blood sugar is doing throughout the day. and help guide pet parents through their insulin dosing that way. And a lot of checking in is talking about how that cat is doing at home. How are they doing with their appetite and their weight? I really encourage pet parents, especially cats 7 and up, to have a scale at home and to be weighing their cat. So absolutely, if your cat's diabetic, getting weight checks on them is really helpful, and we compare that with the information that we get from the insulin and the blood glucose. So we can do a lot through telemedicine. I would say for a pet that's newly diagnosed with diabetes, or if we suspect that's what's going on, and they have the potential to be really sick, that's often an in-person visit and some stabilization and the initial getting the right dose of insulin. Well, we have new tools, we have new medications now, but that's often an in-person visit. Well, would you agree, Dr. Carr?
Yeah, I think certainly in the initial one, and I agree. I think that one of the,
Oh no, we cut out. Dr. Carr mentioned that he's in a rural area of Canada, and their internet is not always the best. I will cheat a little bit, though. I do have a friend who's in internal medicine, and we have these, actually, we have one today where we do veterinary all hands meetings where we get all of our vets together and we have a guest speaker come in. So our most recent one was an internist talking about how you can use telemedicine to manage diabetes in pets. So using the information from my friend who's an internist, I know that's something that she does regularly in her practice and her clinical practice. So I don't want to put words into Dr. Carr's mouth, but I think that's where he was going.
What about, do you feel like on this chat we covered enough about GI issues as well besides UTI issues?
Yeah, I was just going to engage Dr. Carr on that too, because before going live, we're talking about that a bunch and how, when I started practicing medicine, we used to use antibiotics, metronidazole, to treat lots of GI issues in dogs. And he and I were going back and forth about how much that's changed. Hi, Dr. Carr, welcome back.
That's the power of rural internet. So I was hot spotting it with my phone, and my phone decided that it wanted to almost catch fire. So now I'm back on a slow one. I think the only thing I want to mention with diabetes, when we talked about food in diabetic animals, especially cats, having the right food is very, very important. Like, it's one of the initial studies that were done actually showed that some cats that were probably initially diabetic actually stopped being diabetic once they got the right food, because cats like protein and fat. They don't like carbohydrates. So important part of management of diabetic cats is the right food. So, and I think so we can help out quite a bit with that. And I agree with Dr. Eldon that the goals are completely different. Goals in humans for diabetic management are to avoid the serious complications like eye problems, kidney problems, and for that, it requires extremely good control. In cats, the main issue is treating it enough so that they don't lose weight, that they don't drink and urinate constantly, and that they don't have a ravenous appetite. And that's possible to manage that way better than what it is. And we can, I think, telemedicine can definitely help out with that, to always be able to touch base. Because as a veterinarian, I know in practice, it can be really hard. Just sometimes people have to talk to the vet all the time till they get things straight, or just till they feel comfortable with it. And that's not always possible in practice.
Right. And that's the beauty.
That's the beauty of telemedicine. Like, I think about a cat that I had who, when I lived on a ranch, I had a cat, an orange tabby cat named Studebaker, and getting him to the clinic was stressful, and he would start peeing all over. And so, if you've got a pet with a condition like diabetes, and, thinking about to to talk to a vet if you have to bring them in every time. Like that process can actually be really, really stressful. And it's important for us as vets to remember that kind of burden that we can put on people when we say you have to come in every time, when, you know, if we can do something remotely, it'd be really helpful.
How do, speaking of diabetes, how would you advise, or how do you parents start to notice that there even is diabetes and try to detect it in their pets?
So with diabetes is also quite different in dogs and cats. In dogs, it tends to be they absolutely need insulin. In cats, sometimes you can get by without insulin. So cats have type 2 diabetes, dogs have type 1 diabetes, and the clinical signs are going to be fairly similar. So one of the first signs they may see is that the animals will be drinking a lot, which means they're also going to urinate a lot, and they may urinate inappropriately. They're also at higher risk of having urinary tract infections. So that may be one of the signs. Quite commonly, it's weight loss, right? So even though the animal, and when we think about, like, when I work up a case, there's always kind of a list of differentials. So if I have a clinical sign, what are the most likely causes? And one of the most likely, what we see in both dogs and cats, is weight loss with a preserved increased appetite. If you don't eat anything, you're going to lose weight. That makes common sense. But if you're actually eating and drinking normally, or even more than usual, and you're losing weight, there's something else going on. So in a cat, that could be hyperthyroidism. But again, diabetes is a major one of the things we think about. In a dog, probably diabetes is actually one of the major causes. So that's really one of the things to watch for, is weight loss that's unexplained with an animal that's still eating.
And are certain breeds of dogs more likely to get diabetes, or is it more likely also to happen as they age?
Schnauzers come.
And Schnauzers probably because they also tend toward chronic diabetes or chronic pancreatitis, which may also affect it. In dogs, we'll also see it in intact females. So during the time when they're kind of going through their heat, shortly after that, they can develop diabetes from that, and usually it's permanent. So they may just show signs and then become diabetic. In cats, it's usually middle-aged to older cats that wind up with diabetes. Also tends to be the overweight ones that are more likely to develop diabetes.
Cool. Well, time flew by. This was so awesome. I love getting your take, Dr. Carr, on how UTIs and digestive issues can be treated via telemedicine. And what a lovely chat. What a lovely chat on UTIs this morning.
I really appreciated having you on, Dr. Carr. It was great.
Yeah, thank you so much. We have a special promo, Tummy 50, TUMMY 50, for those who want to try us out. But we will see you next week, Thursday morning. Thank you all so much. Thank you, Dr. Carr.